Hello world, Dr. Keith Grimes, the VR doctor here again in Facebook Spaces, day 5 of my exploration of what it's like to consult in virtual reality. Today we're going to look at sharing information in a more permanent way, as in when you come to doctor, you find out something, they give you information. What can VR offer to give you an uprated experience of information sharing? So, today I'm going to use the example of ear infections, and you can see on the screen behind me a little what we call a patient information leaflet. This is from patient.info, which is an excellent site that not only provides information for doctors, but also for patients. And this is a little information about ear infections, or otitis media, as we often call it. So when you come and see a doctor and you have an examination, they'll talk to you, and we talked in one of the previous episodes about how you might improve a person's recollection of what's going on. So one of the ways that I'm sure you've been through before is that you go to the doctor and they give you a patient information leaflet. They'll give you that. Now, back in the day, I can still remember the time you would actually have a little filing cabinet you would search through and then pull it out, and there you go. Piece of information to give the patient. And of course, in medicine, there's lots of different things, so you'd have lots and lots and lots of different information leaflets. Or you try and get a small amount of ones. But what you can do now is you can get PDFs of this and print them out and give them to the patient. But this is still something in hard format. So what can you do? Well, you can direct them to the internet. And here, of course, patient.info. And if I've got a little controller here, you can scroll up and down. There's a little diagram in there as well that you might want to look at too. So if you're lucky and the doctor's sharing the screen with you, you can see this information or print it out. But of course, see that picture there? You want to try and get a better understanding of what's happening inside that ear of yours if you've got an ear infection. Well, there's a diagram there. And what I've done is I've just taken that, and let's see if we can see a bigger picture just there. So I could be sitting with you and you could be watching just like this, and I can talk about here's an ear infection. Hopefully I'm pointing at the right bit. There's the outer ear, there's the external canal, the eardrum, and then the middle ear. So sometimes you'll get an infection in that area. And doctors will sometimes draw rough little diagrams to give them to you, explaining what's going on, if there's infection here, or if this little tube here, the eustachian tube, which communicates air from the outside world to behind the eardrum to equalize pressure, that's blocked and you get that pain sensation. So that's another, I'd say, a fairly traditional way of doing it. You either have a diagram of this or a person looks at a page with some more information. So what can VR do? Well, one thing you can do as well is I could actually summon up some video here. Now, this is not for the squeamish. I'll bring this up in the background. So, and there is a video off YouTube. And if I just open that up, it's just showing some videos, and this is huge in the background behind me. If you were in here with me, you'd be seeing it, and we can discuss it and say, well, what does this look like? This looks like an eardrum, and you can see the pressure behind it there. There's another one, a very, very bulbous looking eardrum, obviously with a pus and infection behind it, pressing out, and that'll be very, very painful. So I'll stop that for you just now. Like I said, I've no idea what's happening in these later ones. It might be something really gruesome. So let's get this out of the way. So far, but these are all things that you can do, these are all things that you could probably do inside reality, not just virtual reality. Now, if you remember a couple of days ago, I showed you some of the drawing tools. So if I bring up one of the drawing tools here just now, you have this pen. Now, doctors love drawing pictures, and sometimes they're very crude. I'd like to be able to import a proper anatomical image, but what you could do is I could say, well, see this in the background? I could draw a diagram of an ear, and then the tubes coming off it, and you could maybe have a look at it. And because it's in 3D, I could sort of show you. Now, that's a equally terrible image, so I'm going to get rid of that. But there is one that I did earlier, and here it is just now. Let's have a look if I can bring it up. Ta-da! Now, I'm not going to win any awards for this, that's true, but what this is really good for is I can shrink it down and say, well, look, you can see tiny little things sitting inside the ear just there. And if I zoom it out, I'm just going to clear off that background because it's a little bit distracting. I'll put this up in the air, and I will come back to my consulting room. No, that's better. The park's better. Let me just get rid of this. Oh, I can't get rid of that. There you go. So here's this object again. So I'd be able to just shrink this down to you and say, well, look, we've got the external ear just here. We have the auditory canal, the eardrum just there, and then malleus, incus, and stapes, the little bones inside the middle ear just here. This middle ear space is the one that's often full of infection for patients, then eustachian tube. And this yellow snail-like thing here is the cochlea, where you do the hearing, and you have the little vestibular canals, which help with that sense of balance. So, pre-cooked thing, I'd love to have a decent anatomical diagram to do here, and so the world wouldn't be exposed to my terrible drawing skills. But when I have this as well, I can share this with the patient too. So afterwards, if they're also on Facebook or some social secure platform that we can use for consultation, I could share this with them simply by sharing with friends. And I've got a little control panel that you can't see here. Press the button and away it goes. Shared my drawing on Facebook Space. And then the final thing is that you want something slightly more dynamic. What we'll do is I'll bring up my pen, and I can try and explain to a person how inflammation of the eustachian tube can block it. So this space here is behind the ear, behind at the back of the nose. This is the middle ear. And what I can then do is I can take this out and I can draw people and say, well, you've got an infection in this central area just here. And this area here has become swollen. And so what we can do is I can give you some medication that will maybe cause decrease the swelling in this area. And if I'm lucky, and I'm not being terribly lucky just now, swelling goes, airway patent, infection drains, you're feeling better. But maybe that'll help you understand it a little bit better. Or maybe not. I don't know. This is exactly why I'm exploring virtual reality for this. So I'm going to stop just now. Thank you for watching. If you have any questions you'd like me to address about what it might be like to practice medicine and speak with doctors inside virtual reality, you can follow me on Twitter. It's @KeithGrimes. I have a Facebook group called VR Doctors, where we have doctors and clinicians, developers, patients, academics, where we can discuss what it's like to use VR and augmented reality and mixed reality in healthcare. And I also do a podcast. That's what this t-shirt's about, called Curistica, and that's me just there. And I'm not trying to perform any kind of magic on you just here. This is me, my mind being blown by the world of digital health. Anyway, for now, it's goodbye, and I'll see you next time as we look at another aspect of consulting in virtual reality.